This was a phase 1-2 dose escalation studies of a gene therapy vector developed by a company, 4DMT. And they use a technology, let's just call it clinical evolution. It's a way of naturally tweaking the virus to constantly mutate, and each virus that comes out has a chance of being will be different and has a chance of doing something that you want it to. And so you can do multiple rounds of this process, select the ones that do what you want it to, and over the course of a few rounds of this natural evolution, you can directed evolution. That's the word that they like. After several rounds of this directed evolution, you get a virus that now looks more like what you want it to, because you've selected it to do that. So the process that the companies use is called directed evolution. So they did this. They came up with a vector that in the data that was presented at this study, the company was able to show that unlike traditional enzyme replacement or first generation AAV vectors containing the gene for the a-galactosidase, their vector could get into the heart and the kidney, and therefore had the potential to be able to be more effective than standard or the original generation of AAV vectors. They checked, those were mouse studies. They also checked the distribution of the vector in non-human primates. That's a requirement for FDA approval in gene therapy trials. So they did that, and indeed showed that it got into both heart and kidney in the primates. So they were ready for a clinical trial, and the clinical trial design. Let me back up for a second. In the primates, they also showed that they were able to get really high levels of the enzyme in the primate blood stream. So the vector was infecting the liver and making a lot of enzyme. So it got both tissue distribution and made a lot of enzyme. So now they were ready for a clinical trial, and the design of the clinical trial was going back to those primate experiments. They picked a dose that in the gene therapy world is a relatively low starting dose, 1 times 10 to the 13th viral particles, and so that's a low dose, for the first 3 patients, I'm sorry, the patient population was males. It could be males that were either of the severe form or have a milder variation of the disease based on the mutation. Didn't matter. It did not matter whether they had already developed antibodies to the alpha-galactosidase from previous enzyme replacement therapy, unless it was very, very high, sky high. And it didn't matter whether or not they were on enzyme replacement therapy or, in fact, were naive to enzyme replacement therapy. The goals of the study were to, first of all, safety. It's a phase 1 trial, so it's safety rather than efficacy. But the secondary endpoints were to look at the levels in blood, so to see whether they could get an efficacy signal, at least from that standpoint, and then look at non-invasive monitoring of the heart using cardiac MRI and echocardiography to look for improvement in function. So of the first 3 patients that were enrolled in the study were all male. That was by design. 2 of them were still on enzyme replacement therapy. 1 had done enzyme replacement therapy but had stopped it. The two that were on enzyme replacement therapy had measurable but relatively low titers of anti-alpha-galactosidase antibody. The third patient that had stopped enzyme replacement therapy had really high levels, but they were low enough that he was able to come into the trial. And they were all negative for antibodies to the virus, and that's one of the problems with these viruses is since they're natural, the possibility is that you might have seen one in your lifetime. You could actually be immune to it, just the way you would be immune to any other virus. But none of these individuals had that. So 3 patients were dosed. The patient who is farthest along is at 38 weeks post-dosing. The next longest patient is at, oh no, I forgot. I think it's about 20 weeks. Not quite as far as the first patient. And then the third patient, because of some challenges in collecting all of the data, is further out, but we only have data out to about 16 weeks on that patient. The two patients that were still on enzyme replacement therapy had remarkable increases in their enzyme, 10 to 14 times the upper limit of normal for the enzyme. So it was really quite high and way higher than you get with enzyme replacement therapy. They both stopped their enzyme replacement therapy. Actually, that was where they settled out, 10 to 14 times. It was higher initially. They stopped their enzyme replacement therapy. It came down and they settled after another few weeks at those. One was at 10 and one is at 14-fold elevated. So these were very high from that standpoint. The other patient, the one who had stopped his enzyme replacement and had the high anti-AGA antibodies, did not respond quite so robustly. However, his enzyme levels did at least come into the normal range, which was encouraging. And there's a marker that accumulates in the blood that can be measured, that in the 2 patients that were on enzyme replacement therapy was pretty much in the normal range, but was very high in the patient who was off enzyme replacement therapy. And even with the enzyme just going up to the top end of normal and settling out right at the bottom end of normal, the level of that molecule dropped by 50% in the short period of time that the patient's been followed. So it at least looks like it's having a biological efficacy at that level. Looking at the the functional markers, the cardiac markers, the only one who's far enough out to be having that testing done already is the patient that had the levels at 10-fold elevated, I think. I forget which, it might have been the 14-fold, one of the high ones. He had an improvement in both his cardiac MRI and his function measured by echocardiography, looking at a couple special techniques that can be done to measure by MRI the accumulation of the chemical that backs up in this disease without treatment, and so it looked like the heart function was getting better as that got cleaned out, and then the echocardiography, which actually measured the function of the heart itself, improved. Now that's one time point. And they were modest improvements, but they were above the baseline measurements of the disease. So it looks like, or of the techniques rather, and so it looks like it probably is real. So it looks promising, and recognizing this is a small number of patients for a short period of time, but at least all 3 have had blood levels go up, have stayed up, though the first 2 stayed up higher than the third one that I mentioned, and appear to have some functional effect, either clearance of that chemical in the blood, or an improvement in heart function. For heart function, we also looked at a scale called the Kansas City Cardiomyopathy scale that was a questionnaire. How do you feel about, and answer how you're able to do daily things of life. And that patient that had the lowest increase in enzyme had the lowest score of that. High is better. But he also had the most improvement, even with a lower level of enzyme response. The other two didn't have very abnormal scales to start with, and so there wasn't much change in them. From a safety standpoint, it looked pretty good. There were no real liver issues. There were no cardiac issues identified. There were no kidney issues identified. One of the patients, the patient that had the lowest response, had a condition called hemolytic uremic syndrome, and this is a recognized complication now of AAV therapy. The virus seems to trigger an immune response in the body that goes haywire, and you get acute kidney damage. Red blood cells break down, so you become anemic, and you can lose platelets. They break down, and so you can have bleeding problems. He had biochemical an increase in those markers, so the process was clearly going on, but he was completely asymptomatic. To be safe, he was admitted to the hospital. He was watched for 4 days. They all came back down to normal, and he was discharged. So even with that as a more severe adverse event, he didn't require dialysis. He didn't require some of the more heavy-duty immunosuppressants that are used to treat that particular condition. So it's as you said, it's an early read, but it looks quite promising, and we'll certainly be looking forward to the news of additional enrollees as they become available here in the coming year. The goal is to get 6 in the lowest dose cohort. We'll bump the dose by a little bit, and then a decision will be made as to which dose to use going forward. And then there's going to be a little bit of a sub-study where they'll be able to enroll patients who have a low level of antibodies to the vector to see whether or not that will decrease the efficacy of it.